Hi everyone, welcome back to my YouTube channel, Nursing with Beatrice. I am Beatrice and today we'll be looking at the topic deep vein thrombosis, or we call it DVT. Deep vein thrombosis is a disease condition where there is formation of blood clot in the deep veins. For us to better understand this topic, let's just recap, let's take our mind back to how blood flow or circulate in the heart. And let's remember that we have arteries and we have veins. Those days, if we used to remember, we say arteries start with A, meaning away, right? So we say arteries are blood vessels that carry oxygenated blood away from the heart. And we say vein, we do the opposite. Veins carry deoxygenated blood towards the heart. Even if the arteries carry oxygenated blood away from the heart, we have the pulmonary artery that do the opposite. They carry deoxygenated blood towards the heart. And then we have the veins. They are doing the opposite of the artery, like I said. They are carrying what? Deoxygenated blood towards the heart, except the pulmonary veins, which carry oxygenated blood away from the heart. So I've tried to, if you look at this diagram, I try to differentiate it with two colors. This right side showing blue is showing deoxygenated blood. The left side with red is showing that the blood is oxygenated. So usually, blood that is coming from the upper extremities, from the head, from the hands, are emptied into the right atrium through the what? Superior vena cava. And blood coming from the lower extremities are emptied into the what? Right atrium again through the inferior vena cava. Now, when this blood gets in here, we're not looking at the conduction activities that happen in the heart at this time, but we know that when those electrical conduction happens and all these discharges occur, the blood is pushed down through this right atrioventricular valve, which is what we call tricuspid valve. The blood enters into the right ventricle. When it gets into the right ventricle, the heart contracts and the blood pushes through this pulmonary valve into the lungs for oxygenation, for the lungs to give oxygen, to add oxygen to the blood. Once oxygen has been added to the blood becomes red. It's returned back to the left atrium through the pulmonary veins. When it gets to this left atrium, the blood is pushed down through this left atrioventricular valve, what we call bicuspid valve, into the left ventricle. When the blood gets to the left ventricle, the heart also contracts and the blood